Okay, so now we're going to talk about a classification system for fetal heart rate tracings. We talk about fetal heart rate tracings as category 1, category 2, category 3. A lot of tracings start out category 1. Most are going to have something at some point that puts them in category 2. But sometimes we'll see one that stays category 1 through the entire labor. Okay. Category 1 is considered basically perfect. Category 2 is we're going to watch this. We're going to watch this, but and we're going to keep the provider updated. Okay. Category 3, the provider needs to be notified immediately, and some intervention is going to need to be done immediately. Okay. So even with these categorizations, if we're having decels that are concerning, we're still doing the interventions we talked about in the last section. But the categories help us figure out the urgency of getting a provider there. So first of all, category 1, let's look at an example. A category 1 strip, the baseline fetal heart rate baseline is between 110 and 160. We can see this one, the baseline's about 150. Okay, so between 110 and 160. Variability is moderate. This variability is between the ranges between 6 and 25 beats a minute. It has around a 15 or 20 beat range. There are no late or variable decels. I see no decels on this strip at all. Okay, and there are accelerations present. Okay, if we have decels, they are early decels. So this I would consider a category 1 strip. This is perfect. This looks fantastic. Okay, so let's move on. We're actually going to skip category 2 because category 3 has very specific guidelines, and there's a few guidelines. There's not 10 of them. So it's got very specific guidelines, and if it doesn't fit in category 3 or category 1, it's going to go in category 2. So let's look at category 3. Any one of the following things is category 3. Okay, if there is no variability and recurrent late decels. So let's look at a couple of strips that show what that looks like. We've looked at this one already when we were talking about lates. If we look at this strip, there's no variability. The fetal heart rate baseline is 160 with no variability, absent variability, and no accels and late decels, and they're with every contraction. This is a category 3 strip. I'm calling the provider for this strip. If this patient is not very, very near delivery, or there's not a problem that we know what it is to fix it, they are probably going to have a C-section. I have seen a provider who had some anxiety about doing unnecessary C-sections. I've seen a provider sit on a strip that looked like this for an hour, and that baby was brain dead. Actually, for several hours, but it was about an hour after I got there. I think it had been going on for quite a while, and that baby, when they finally went to C-section, was brain dead. So let's look at another example of that. And I don't know if the share is letting me switch frames. I'm going to unshare and reshare. This is another example of absent variability, late decels. Now, these decels are deeper. You would think, if we're talking about late decels, that deeper lates are more concerning. But in reality, if the lates are shallower, it means that fetus has nothing left to give. They cannot even adjust. If they drop their heart rate, it's probably not coming back up. So the most concerning strip I've ever seen was a straight line with very tiny dips, like 1 or 2 beats per minute dips after every contraction. That's a terrifying strip because that fetus is absolutely out of any ability to compensate. And if the heart rate drops any more than that, it's not going to come back up. So absent variability, recurrent late decels. Now, the next one, you're going to see a theme here. Absent variability and recurrent variable decels. Remember, variable decels are usually from cord compression. Okay. And if they're from core compression and everyone's otherwise healthy, usually you'll see pretty decent variability between them unless there's just too many or they're too long. Okay. But if you have absent variability and you're just having random drops in the heart rate, that actually isn't always core compression. Sometimes it's the fetus losing the ability to maintain a heart rate. So we're going to look at the closest I could find to this. I've seen strips that are actually a better representation of this, but this is the closest I could find. This is absent variability. And then we have a decel here that could be variable. If this is a contraction we're not picking up, it could be late. But no variability at all here. Recurrent variable decels. This is category 3. We are calling them provider. Okay, the next strip that is category 3 is absent variability and bradycardia. This might be scarier than the lates. I've never seen this in person, but this is also a really non-reassuring strip. And this is an immediate call to provider. So what does this look like? The fetal heart rate baseline, oh, and it's dropping. Started out at about 70, no variability at all. These weird little blips that show it can't really keep a consistent heart rate, and it is dropping. That baseline is dropping, and it's dropped to 50 by the end of this strip. This is a fetus in trouble and may actually already be dying. This is a strip that you don't want to see. The last one that we consider a category 3 strip is sinusoidal. So we're going to go back and look at what that looks like again. Okay, this is a sinusoidal pattern. Don't mistake it for variability. This indicates severe compromise. Okay, this fetus isn't adjusting to anything. It just is having this weird wavy heart rate pattern. This is not, this is a category 3 strip. So we've looked at category 1 and category 3. Category 1 is perfect. Category 3 is call the provider immediately. So category 2 strips is basically what's in between there. So if we have baseline bradycardia, but we have any variability, minimal to moderate variability, okay? So baseline bradycardia with any variability, then we call that a category 2. I'm going to be watching that patient closely for changes, okay? If we have baseline tachycardia, so the heart rate baseline is 170 or 180, we're observing that patient for changes. If there is minimal variability, and remember that I said a lot of strips toward the end of labor, we're going to see minimal variability as the fetus gets tired. That's category 2. But we're watching. Absent variability with no decelerations at all. So if we have 0 variability, we better make really sure there's no decels, because everything else, if we've got absent variability with any other changes, they're category 3. But absent variability with no decels at all is category 2. Marked variability, we're just all over the place. Okay, that's category 2. If we apply some fetal stimulation, like scalp stimulation, or use the vibroacoustic, and we don't get any acceleration, that's category 2. If we have recurrent variable decels, so we're having variable decels over and over, but we still have good variability, minimal to moderate variability, okay? Prolonged decels, remember those long stretches of decels, those are category 2. Recurrent late decels with moderate variability. So if we have recurrent late decels, but the variability is still moderate, that's category 2. Variable decels with a slow return to the baseline, overshoots, or shoulders. Okay, so all of those are category 2. So let's look at a few examples of that. So this is fetal heart rate baseline 140 with minimal variability, no we don't really have accels, we have overshoots on the recovery. So no accels noted, variable decels down to 80 with shoulders with rapid recovery. Okay, so this would be a category 2 strip because we have recurrent variable decels, minimal to moderate variability. Okay, let's look at another strip. Okay, we still have, let's see, fetal heart rate baseline 150, probably moderate variability or close to it, right on the bubble of minimal to moderate. I would call this moderate, especially if I had a longer strip that looks similar. No real accels. We have variable decels, 1 to 120, but we have one down to 50. That's lasts about 2 minutes. Recovers, there's shouldering, especially with that one, but it recovers to baseline with probably moderate variability. Now, if you look right here, there's this little dip. I would like to see more of a pattern. If we're seeing this dip just after the next few contractions, that's a late decel, and it could be temporary. Sometimes after a big decel, we might see decreased variability and some lates for a few contractions. With this shortest strip, it's kind of hard to see, but it's possible that that might be a little bit of a late after that. This is still going to be a category 2 strip because we've got decent variability. Okay. So let's look at the next one. Okay, we have a fetal heart rate baseline 130. We have minimal variability, and we have recurrent late decels. So late decels with moderate variability are category 2, but it doesn't say that minimal variability is category 3. So we're going to go with category 2 and watch this really close. Okay. We've got, this might be minimal. I think this is minimal. We've got a little bit here and there. We do have an accel here and there. It looks almost like a little bit of shouldering, but this is one we're going to be watching closer. Okay. Okay, let's look at this strip. Is this category 2 or category 3? We have a fetal heart rate baseline of 160. I see no accels and no decels. Okay. But I see no variability. So if we have no variability, but no decels at all, that's category 2. Now with category 2, we're monitoring that patient. We're keeping the provider updated. We're letting them know if things are changing. Okay, category 1, proceed with a normal care. Category 2, monitor, keep that provider updated. Category 3, contact the provider immediately. Okay, in the next section, we're going to talk about lab and diagnostic tests.